Killer cough syrup that allegedly led to the death of 20 children across the country. The tragedy exposes huge chinks in India's drug control armour and has also raised some very tough questions. Now, the owner of Tamil Nadu-based Sresan Pharma, the company that manufactured the adulterated Coldrif cough syrup, has now been arrested by Madhya Pradesh police in Chennai.
That's right, Vasudha. Ranganathan, who's the owner of Sresan, was taken into custody this morning by the Madhya Pradesh police. Two other employees of that company are, I believe, being questioned by the Kanchipuram police, and the Tamil Nadu government has also suspended two officials. But none of this, Vasudha, answers a critical question. How was the pharma company allowed to function for over a decade, I believe 14 years, flouting several norms if it has consistently, and a single visit by the authorities after they were alerted by the Madhya Pradesh government revealed over 300 flaws and 300 lapses in that company? So that's really the crucial focus question right now, Vasudha. Let's just listen in to the reactions that came in from earlier in the day.
जहरीली दवाई के आधार पर जो बच्चों की दुखद मृत्यु हुई या वो बीमार हुए, इसके खिलाफ हमने तुरंत एसआईटी का गठन किया था। और आज मुझे जानकारी दी गई कि हमारी पुलिस ने न केवल तमिलनाडु के अंदर उस दवा निर्माता को पकड़ा है, दबोचा है, ये बात वो बताती है, जिसके कारण से हमारी सरकार इन कामों के कारण जानी जाती है जो दक्षता के आधार पर होते हैं। दोषी कोई भी हो, हमारी सरकार उसको छोड़ेगी नहीं।
जो एसआईटी जो यहाँ से गई थी छिंदवाड़ा से, उसके द्वारा जो श्रीशान फार्मास्यूटिकल्स के जो मालिक हैं रंगराजन, उनको जो है लेट नाइट उनको जो है राउंड अप किया गया और उनकी अरेस्टिंग की गई है। जो प्रक्रिया है उसके आगे के उनका मेडिकल और बाकी की जो कार्रवाई है वो चेन्नई से करके उनको फिर यहाँ लाया जाएगा।
So what does this expose about the regulatory framework in India? Not the first time, Vasudha, that such cases have come to light. Joining us this evening, T. Prashant Reddy, co-author of The Truth Pill and the Myth of India's Drug Regulation. Also with us, consultant pediatrician Dr. Arun Vadwa. Prashant Reddy, first to you. How do you see this tragedy? Is this an exception, or does this reflect the larger reality of the drug control mechanism and the regulatory framework in India? Who would you hold accountable for it?
I mean, this tragedy, it's not very surprising, right? We've had, I think this is the 9th tragedy since 1972 involving just cough syrups or, something to do with DEG poisoning. We've had other tragedies in India with injectables and intravenous fluids being contaminated. So none of this is unfortunately surprising. The question of accountability is a little bit trickier because of the way the Indian drug regulatory system is designed. It's the responsibility split between the states and the center. And that's one of the reasons we think that a lot of these tragedies are happening, because every state drug controller is responsible for issuing manufacturing licenses in his state. But they don't have jurisdiction outside their state. So, for example, the Madhya Pradesh drug controller can't come and inspect a plant in Tamil Nadu and vice versa. So there are a lot of cracks within the system, and a lot of bad actors slip through those cracks. But I mean, a first starting point to fix the system is we need to have something like a commission of inquiry to conduct a deep probe into this incident and try and fix accountability for what went wrong. Because dismissing the drug controller in Madhya Pradesh makes no sense.
Right.
That poor guy can't do anything to inspect a plant in Tamil Nadu.
Right.
So rather than these reflex reactions, I think a proper commission of inquiry
so
would be a good starting point.
I think the problem is also because maybe the system is too centralized and there is no accountability. But I also want to ask you about the policies that have been put in place. Is there a problem of the policies being implemented or the policy itself? Because given there is a 2023 mandate that requires cough syrup manufacturers to obtain a certificate of analysis from a lab that is government approved before export. But how effective has this policy been in preventing distribution of toxic products?
That applies only for export products. It doesn't apply for domestic products. So when they implemented it for export products, export cough syrups, they realized that many cough syrups were failing testing. So about 100 Last year, the Economic Times reported that 100 samples failed testing, which should have been a wake-up call for the authorities. And just to answer your first point, the problem is not that we have to centralize the system. The problem is opposite. We have to decentralize the system, where every state and union territory is responsible for manufacturing facilities in their own state, which is not the way it should be operating in a country like India, which is one single union and one single market for drugs.
You know, when you make that point, and before I go across to Dr. Arun Vadva, very, very briefly, Prashant, look, there was a tragedy of this scale, and hence we are discussing this issue. Do you believe that the norms are being flouted and the system is perhaps designed more towards those who flout certain norms rather than one that's tilting more towards ensuring that there is an absolute no compromise on the quality of medicines that we get?
The problem is the system is designed in such a way that it's completely opaque. So nobody can really peek into, behind the scenes and understand what is happening. For example, take this particular plant in Tamil Nadu. I'm sure none of your reporters have been able to access inspection reports for the past. The recent one was made available.
Right.
But the law says that these plants are to be inspected every year. That doesn't happen once in 2 years. But where are the inspection reports? Because the system is designed to hide all of this. They don't make this information publicly available. The moment you make this information publicly available, bureaucrats will start doing their jobs more seriously because they know next time something goes wrong, their name is on the inspection report.
There's also this information being made public that's important. Dr. Arun Vadva also joins us. Dr. Vadva, as a senior pediatrician, what is your concern? Because, as a parent, the first thing that I did was call up my pediatrician, the pediatrician for my son, and ask him as to, how serious is this issue? How are parents reacting to this, doctor? What kind of calls are you getting right now?
Thank you for calling me. Fortunately, not many people are calling. I don't know why. I mean, maybe people don't read the newspapers now or what. Somehow, even I was expecting there'll be a flood of calls asking whether we should give the cough syrup or not. But somehow nobody's been asking. What we normally do here is just to see that it's a good company syrup. We normally avoid giving cough syrups in children less than 4 years of age. And here, the cough syrup was made by a local company, which, like he was saying, that maybe the testing wasn't good. The cost cutting was there. Maybe it was deliberately added or whatever. But unfortunately, all this has happened.
Right. No, I don't know whether to laugh or cry when you say that you haven't been getting calls and perhaps people aren't being aware of this. But Dr. Vadva, very, very briefly, let's look at a prescription for this. As a pediatrician, and I'll give Prashant the last word after this, what would you believe needs to be done at an urgent basis to ensure we don't have such a situation again?
No, that's exactly what he said just now, my earlier speaker, that we should have an inquiry commission rather than haphazardly, suspending people. The doctor was suspended. He's not going to test the cough syrups. He's been writing that for 10 years now. And so suspecting an inspector of MP where the cough syrup was sold, it wasn't made there. So that inquiry has to be made urgent, fast, and publicly, displayed what is the problem. And the concerning person, whether he did it intentionally or happened without that, just to cut the cost or whatever, that person should be taken into account. I mean, he should be accountable, not the others.
Prashant Reddy?
But you see, Vasudha, pardon me for interrupting here. Doctor, that could result for a solution and fixing of blame in this case. Prashant, as a larger system in terms of response to this, what should be the one key thing we go back and do this? Are you saying that we should not have drug controllers in each state? Should we centralize the process?
Yes, I mean, that suggestion has been on the table since 1954, where the recommendation has been to centralize licensing at least. But even if we can't do that, because this is a political hot button issue,
Yes.
Even if we can't centralize licensing, we can at least mandate the creation of centralized databases where inspection reports, test reports are shared. Because if there's greater information sharing between states and to journalists, we can keep track of what exactly is happening. So I would say any kind of reform targeted at greater transparency will be a good first step forward to tackling this crisis.
Also, not, we can't blame the dextromethorphan. They're blaming that the cough syrup, dextromethorphan is responsible. It's not. It's the contamination which is important. And why blame the doctor?
Exactly.
Right. You can't blame the doctor because they are prescribing a medicine that's acceptable. If it's contaminated,
Yeah,
one
and
can't
he's been writing it for 10
find a
years
solution to it. But I think the hope really is that there will be addressing of this issue at a holistic level, perhaps, which exposes chinks in our drug regulatory armor. Thanks very much, Prashant Reddy, as well as Dr. Vadva, for joining us here on the Southern View this evening.
Some very important suggestions have come from both our panelists, Veera, and that is something probably the government also needs to listen to. India wants to be the pharmacy of the world, and the task at hand right now seems to it's important to prove that every pill that India produces meets the highest standards of safety, transparency and accountability, and that is really challenging.